Hi, and welcome to a 6-minute course about cold sores, the who, what, when, why, and how of cold sores. I'm Dr. David Miller. I'm a naturopathic doctor, and I'm the designer and developer of Sorlax, which is a natural cold sore remedy. Why are cold sores important? Over 60 to 70% of us are infected. That's a lot. Increases as we get older, too. Generally, they're a nuisance, but they can be serious or deadly in some cases. They're even one of the torch perinatal infections that can lead to birth defects in infants. So that's some serious stuff. The virus lives with us for life. There's no cure. That's right, there's no cure. The virus evades the immune system and lives inside our neurons. A bit unnerving, right? But also very interesting from a medical and health perspective. There's some implications maybe for understanding neuroimmune disease, and there's some correlations with Alzheimer's, which is very, very prevalent in our society. So maybe we can learn a thing or two about preventing Alzheimer's when we learn a little bit more about this virus. Most treatment options are underwhelming. Very, very seldom are people entirely satisfied with their treatment that they're getting for cold sores. So there's room for improvement here. We need to better understand the virus and how it works and maybe some better ways of treating it. But let's be honest, they're ugly, painful, and they make us feel disgusting, untouchable, and not part of the group. Look, we're primates and we're social animals, and if we don't feel part of the group, it's not good for our health. It doesn't feel good in any way. So let's start with what are cold sores. Basically, as you probably know, they're painful, ulcerating lesions that most commonly affect the mouth, including the gums, the lips, the throat, and ocular areas of the face. They can actually lead to blindness in some people. So very, very dangerous condition in some cases. So primary versus recurrent cold sores. The first and often most severe infection is called the primary infection. And then after the primary infection, subsequent infections are called recurrent infections. They can be painful, but they're generally less severe than the primary infection. They're usually found in the same place where the primary infection occurred. And how are these things spread? How are cold sores spread? Well, they're spread by skin contact with the virus. But they don't necessarily have to be spread skin to skin. They can actually be spread by exposure to body fluids like saliva. And importantly, we're contagious all the time. You may think, oh, I'm only contagious when I have an outbreak. That's only partially true. You're probably most contagious during that ulcerative stage. However, you're contagious all the time. So there's viral shedding occurring all the time. The virus is caused by a member of the herpes viridae family, and it can be caused by HSV1 or HSV2. It's more commonly caused by HSV1, but HSV2, commonly associated with genital herpes, can also cause cold sores and vice versa. They're relatively large and complex DNA viruses with two distinct stages in their life. They have the lytic active stage. This is where you have an active lesion where you have the prodrome and the tingling, and then leading to the lesions where they're weeping and ulcerating and all that. Or you have the other stage, which is latent or sleeping. So usually it's staying in that latent or sleeping stage, but when the cold sore is active, you know it, it's in that lytic stage. And this is just a diagram to show that basically we have the dormant virus hanging out in our nerve, and then can stay there for a long time, long periods of time. It can stay there for years. And then when some sort of inciting event happens, we're stressed or what have you, the virus then goes and shows itself in the skin where we have the active lesion. These are the stages of the cold sore prodrome, where we have that tingling, papules, things start to get a little red and raised. In the vesicle, where you get these trademark sort of little vesicles, the little tiny fluid-filled blisters. After that, the ulcer forms. That's very sort of painful time as well. Then a soft scab, and then, of course, the hard scab forms as the healing sort of progresses. So who gets cold sores? Well, not everyone who carries the virus gets outbreaks. Recurrent infections are only happening in 25% of us. And they're often more common in immunocompromised people. So AIDS, chemotherapy, organ transplant recipients, or other immune dysfunctions, which I won't go into detail about, but basically anything that affects our immune system is going to affect our ability to deal with cold sores. When do outbreaks occur in these people? Usually after trauma or stressors, including injuries to the tissue that are supplied by that nerve that's affected. Dental work, very, very common. sun and UV radiation or exposure, nutritional deficiencies, poor diet or poor lifestyle in general, changes in the immune function, so infections, again, chemo, and specific times in a woman's menstrual cycle, most commonly premenstrually. But nutritional deficiencies, here's an opportunity. If you work with a naturopathic doctor or someone who knows their way around diet, you got an opportunity to prevent maybe. Immune function, there's another opportunity. Is there something we can do to support the immune system? And the menstrual cycle, maybe just the fact that we're getting these cold sores during the menstrual cycle tells us we need to work on the menstrual cycle. And then for treatment strategies, whether it's natural or conventional sort of pharmaceutical treatments, will include a inside out or a topical solution, more hardware or software solutions. So hardware, I mean you need to have the vitamins and minerals that are necessary for the immune system to do its job. Software, I'm talking about, there's psychological aspects to cold sores and stress and everything. So there's a hardware and software component. And then short-term acute reactive treatments versus long-term preventative treatments. Both can be used and both are probably necessary for an overall comprehensive approach to cold sores.